As you may have noticed, doctors are overwhelmed, which led us to try to find solutions to face this problem. So, we asked people about this topic through a survey to get a global opinion. Frenchies take 5 medical appointments per year, which does seem normal considering the specialists we have to see once a year, like dentists, ophthalmologists, and others. French people usually find it pretty easy to get an appointment, which is confirmed for the GP since a large majority manages to have an appointment within a week. There, patients have to take their appointments much earlier than for the GP since for 47.8% of the patients, there is from 2 to 6 months between getting an appointment and meeting the specialist. Don't you find this abnormal to wait that long? Although we can see a difference between city and countryside, it's actually harder and longer to get an appointment when you live out of town.
So, to relieve waiting rooms, some of the doctor's tasks may be left to the other healthcare professionals, such as pharmacists. It's already the case for flu vaccine, which can be done in pharmacies. Even though there are solutions, only 3.4% of the population actually got the injection at the pharmacy, and 100% of them says that they are ready to do it again. But wait, 3.4% only? There is something to do to improve that, especially as they found the process well organized, fast, cheap, and easy. The good news is that 68% of those who have never been vaccinated in pharmacies are willing to try out this new system. And to sustain the momentum, 75% of the population will be willing to entrust more responsibilities to pharmacists to help the doctors.
With this in mind, we have thought that basic first aid could be redirected to pharmacies rather than clutter the emergency room. Indeed, although this is rare, people spend a lot of time at emergencies. Even if this waiting time depends on gravity and nature of injuries, the average is about 2 or 3 hours of waiting. To overcome this, 64% of the population thinks that it would be great to have a first consultation with a pharmacist to get first aid. In the same way, 76% of people would like to grant pharmacists with the possibility to prescribe in exceptional circumstances. With this in mind, why not entrust the right to pharmacists to carry out some treatments like blood thinner or insulin injection?
Indeed, around 44% of French already have needed a nurse, and there's about 1% who need them several times a day. Contrary to the case of doctors, the population don't feel any difficulty to find a nurse to practice their cares. They are also widely in favor of receiving their daily injection like blood thinner and insulin in a pharmacy. So, to conclude, French people find harder to get an appointment quickly. To fight this problem, they seem to be open to the solutions we have suggested, no matter their age. While the situation improves slowly, there are always big changes to do in order to upgrade health systems. The role of the doctors is changing, and pharmacists are more and more integrated, especially thanks to their knowledge of drugs, excipients, and drugs interactions.